Hi, everybody. Professor Marvel. I am going to go through the week 7 and the week 8 notes. And then I will send you the recording of this lecture, as well as send you the 7 and 8, week 7, week 8 notes attached to that recording. So hope everybody's doing good. Let me pull up my notes here, or actually, let me pull up our module, like I try and do at the beginning of every class. So let's see, I have sent you the exam 3 study guide earlier. So you do have that. That is going to cover weeks. Oh, I don't know if I share my screen, so hang on a minute. Share. There we are. Okay, so I have sent you the exam 3 study guide, which covers weeks 7, 8, and 9, and you'll be testing in week 10. So when I finish doing this recording, I will then send you the announcement for week 9. Okay, so let's go through the notes for week 7 and week 8. I have listed on the study guide all the readings for weeks 7, 8, and 9, so you'll see that. So let's go over our notes. So what did we cover in week 7? We covered disaster. Okay, disaster management is a really important topic to cover with regards to community and public health nursing. We as nurses are expected to participate in all levels of disaster, whether it's preparedness, response, post-disaster. Okay, so we have two kinds of disasters. Okay, they're either natural or man-made. Okay, some examples of natural disasters are earthquakes, communicable disease epidemics, droughts, and hurricanes. Okay, man-made disasters, some examples of those are pollution, warfare, fires, water supply contamination. Okay, I want you to have a look at the disaster chapter with regards to Healthy People 2030 objectives. Okay, I would like you to be familiar with what their goals and objectives are with regards to disaster. Their main objective is to provide for disease mitigation. Okay, they're focused on preparing, alerting, and caring for disasters, okay, within a community or a specific population. One of their main objectives is alerting the population, okay, providing emergency risk messages to the public. Okay, so I want you to have a look at that. Pardon me. The other thing that I want you to know is when you're teaching a family how to prepare for a disaster, how do you prepare a disaster kit for families? What's important that needs to be in there, and what instructions do they need? Okay, they need enough food for 3 days. Okay, the kit needs to be reviewed every 6 months. We need to make sure the family knows where the kit is located. And we also, the fourth is we need to make sure everybody knows how to turn off the utilities. Okay, so those are the 4 things when educating a family for how to prepare a disaster kit. We also need to know what the purpose of a mass casualty exercise is. I don't know if anybody's ever participated in those, but they're pretty eye-opening. Okay, the purpose of the mass casualty exercise is to evaluate the community's response and capabilities. So it's a drill, and that's exactly what it's used for, to see how well emergency systems were activated and how well that was communicated. All right, obviously, if we do a drill and everything looks well, everything is planned out and operating as it should for a real disaster, we will decrease the casualties. Okay, so that's a fact. And then what federal agency responds? For purposes of this class, you need to know about the National Response Framework, the NRF, okay, and what specific services it provides to the community experiencing a disaster. Okay, there's several things, and it's listed right here. They assist with transportation, temporary housing, medical resources, search and rescue firefighting. Search and rescue and firefighting. Just wanted to make sure I was sharing my screen. Okay, so it is the National Response Framework. Okay, and what services do they provide? Okay, so that's what I would like for you to read about. And this is all in your reading. Remember, the notes are a summary of your reading. And it's fine for you to, you need to review these notes, but you also need to review the readings associated with this. The next topic is infectious disease. Okay, we've already learned about the epidemiological triangle, the host, the agent, the environment. So you should know what those are. The agent is the bacteria, the virus, the chemical exposure. The host is us, the living, who the agent is going to infect. And then certainly we need to take into consideration the environment, the internal and external factors that will be in play of how the host and the agent interact. Okay. Couple of things we need to know about infectious disease. You need to know about passive immunity. Okay, that is immunity from somebody else. Okay, either from a mother or an IV administered antibiotics. And then we need to know what acquired immunity is. Okay, this is immunity that we get when we have a particular disease from previous infections. So maybe think of COVID. If you've had COVID, do you have the acquired immunity from having that disease? And then herd immunity, the third one. Okay, so this is the immunity of a population, herd immunity. That's what, talking about the population as a whole, what is the immunity of the population of the people protecting those that aren't resistant to the disease or illness? We talked about what the agent is. You need to understand the meaning of the word virulence, toxicity. What's the difference between a vertical transmission and a horizontal transmission? You need to understand the differences between those. Vertical, an example of vertical is mother or father to the offspring. And then horizontal transmission would be person to person, other than the parent to the offspring. Understand what an incubation period means. It's the intervals between the invasion of the infectious agents. Okay, so what is the first sign? When do you have the first signs and symptoms of the disease? And then you have your communicable period. Okay, and that's when you can transfer the disease or condition from one person to another. Okay. Last thing about infectious disease is the water. How is the water treated in your local county or municipal treatment facilities? Right? In a home where there's no water service, the family may be forced to be drinking untreated water, which increases the risk of waterborne infectious diseases. A couple of examples of waterborne infectious diseases are cholera and giardia. Okay. The next topic is bioterrorism. I'd like for you to understand a couple of important aspects of bioterrorism. One is anthrax and one is smallpox. Okay, anthrax. And this is in your readings. Okay, these are small cutaneous sores that develop into ulcers, and they do have a black center. GI, nausea, loss of appetite, bloody diarrhea, and fever. Respiratory, okay, deadliest kind, flu symptoms, chest pain, shortness of breath. So that's all. You might observe this if you are caring for a patient that has had an anthrax exposure. If they've had a smallpox exposure, smallpox usually starts off like flu-like symptoms, will develop into a rash with red spots that become pustules. Okay, chickenpox. There's a difference between chickenpox and smallpox. Okay, chickenpox starts out with a rash, smaller red dots that turn into small, clear blisters. Okay, where smallpox develops into a rash with red spots that become deep pustules. What should we be doing to help curb the spread of foodborne illnesses? What's some food safety tips? Wash your hands before handling food, and you can go through the other bullets. These are safety tips. Separate the food, separate raw and cooked food, and a few others. What about waterborne illnesses? Okay, these are usually entered water supplies through animal or human fecal contamination. And we talked about the most common waterborne illnesses are cholera and giardia. What are some vector-borne illnesses? You can take a look at these. What are vectors? Okay, these are mosquitoes, ticks. Okay, so some common vector-borne illnesses are Lyme, Zika, Rocky Mountain spotted fever, and malaria. HIV, what is it? Blood-borne infection spread through sexual contact, sharing of needles, and may be vertically transmitted through breast milk or through the pregnancy. So have a look at some of these infectious diseases. Chlamydia, gonorrhea. Need to know what that is. Same with syphilis. One of the important things to remember about syphilis, okay, if it's not, it's bacterial. So if it's not treated with antibiotics, when it's in the primary or secondary stages, it can become latent and reactive later in life. Okay, and also for pregnant moms, that are not untreated, syphilis can cause significant harm to the baby. I'd like you to review herpes and hepatitis. Okay, these are all summaries of what each of them are caused by, whether they're bacterial or viral, are they treatable? And then tuberculosis. Okay. One of the things we focus on when we do teaching with parents with regards to the control of the spread of infectious or communicable diseases is we talk about vaccines. Okay, vaccines are one of the most effective methods of preventing and controlling communicable diseases. So I experience this in the schools a lot. Parents choose not to vaccinate. That's their choice. We can't be judgmental. We have to accept their decisions, but it still doesn't stop us from trying to educate them that the vaccines are the most important method of preventing and controlling communicable diseases. Okay, so have a look at this paragraph about vaccines. And then we look at some specific infectious and communicable diseases. Here, STDs, that's one. Okay. Certainly a huge public health challenge in the United States. The most common bacterial STDs are gonorrhea, syphilis, and chlamydia. Okay, and most of these are cured with antibiotics. Okay, in contrast, we talked about this a little bit ago, STDs that can be caused by viruses that are not treatable, right? They're considered chronic diseases, and it's really symptom management over the lifespan. And here's where I had mentioned earlier, syphilis. Syphilis can be transmitted transplacentally. If untreated, can lead to serious problems within a few weeks with the baby. Untreated syphilis can cause premature stillbirth, blindness, deafness, facial abnormalities, disability, or death. So if you could please be familiar with these infectious and communicable diseases we just went through. You're going to get asked about those on exam 3. Surveillance outbreaks. Why do we as community and public health nurses need to be concerned about surveillance outbreaks? Because that's where they happen. That's where most of them happen, in the community. All right, so we have a couple of definitions here. So observation and surveillance is the process of ongoing data collection, interpretation, disseminating of health information to the community. Okay, so this is where the nurses are involved in community epidemiology. Think of the nursing process. We apply the nursing process to epidemiology and surveillance. Okay, there's a difference. The process of observation is to assess the public health status, identify trends, set some priorities, what resources do you have, develop a plan, implement your plan, and evaluate. Okay, where the purpose of surveillance is to reduce morbidity and mortality by preventing the control. Okay, so you have to have an understanding of the difference between observation and surveillance. So part of the reason we have surveillance systems, right, is we're trying to detect something early. We're trying to detect something early so that we can implement whatever plan we need to implement to try and reduce the morbidity and mortality. Okay? There's a couple of definitions here that you need to understand the difference of. One is a passive surveillance system. Okay, so we're talking about systems here. All right, so passive relies on healthcare providers to report any existing cases. So as a school nurse, I was reporting in the passive system. I would report something to the health department, and then the health department became the active system, where they were searching for cases, additional cases, by contacting providers. Okay, and then we have a sentinel system. Remember, we're talking about surveillance systems, right? In this type of surveillance, we have key health indicators of common diseases, and we're monitoring those using the sample of cases we have. And then the last surveillance system is called a syndromic system. Okay, and this one focuses on real-time data collecting using an automated data entry system. We did this for COVID. That's how we track COVID cases, through the syndromic system, through an automated data system. The other thing we need to understand with surveillance is how are the patterns of occurrence used when investigating outbreaks. So we have several different patterns. We have a point source pattern. We have an intermittent pattern. We have a mixed outbreak pattern. And we have a propagated pattern. So have a look at what each of these four patterns are. They're all right here in this paragraph. Okay, another paragraph of some definitions. All right, when we are developing community-based programs, we need to conduct a needs assessment. How do we do that? There are different stages of that. Okay, there's the pre-active stage, where the nurse is going to try and project future needs. Okay, there's a reactive stage. Okay, so these are our stages of community assessment of when we're developing health education programs. There's certain stages during the needs assessment. Preactive stage, reactive stage, the inactive stage, and then the interactive stage. And there's a short definition, short explanation of each of these in this paragraph. All right, so you need to be familiar with how to do a needs assessment, what the patterns of occurrences are, or the different kinds of patterns when we're investigating outbreaks, what kinds of surveillance systems are there, and the difference between observation and surveillance. And there are a couple of models that we use for surveillance. One is the patch model. Okay, this is a program that we use. This patch model focuses on mobilizing the community to act. So we want them participating. Okay, we want them helping us collect data, choosing health priorities, and developing a plan. So we're trying to mobilize the community. Okay, engaging them. The second model it's called the APEPH, the Assessment Protocol for Excellence in Public Health. This model focuses on assessing and setting up priorities for health problems. Okay, and then the third model, it's called MAP, M-A-P-P. Okay, and this model develops a framework for long-range planning. So you need to be familiar with these three models. Okay, patch model, AP, EPH, and then the MAP. Okay. What do we know about public health nursing? We know it's the first line of defense, right? We know that public health nursing, we're caring for the entire community or population. We are mobilizing to protect the public during emergencies such as COVID. Public health nurses are preparing for health emergency for years. That's part of the role of public health nurse. Okay. So that's our week 7 content. Disaster management, infection control, infectious and communicable diseases, a couple of examples of bioterrorism, and then surveillance and outbreak. Okay. So that's week 7. Let's go to week 8. Okay, week 8, we covered home care, we covered case management, we covered community resources. Okay, and here's your readings for week 8. So what is home health care? Okay, that is traditionally caring for individuals and families in their home, caring for homebound patients. Okay, we're also caring for, it may be public health nursing visits, right, for primary and secondary prevention. So maybe you're visiting a family for education on new parenting skills. Okay, or maybe you're visiting a family that may be at high risk for, let's say, TB. It's not, I think we find ourselves caring for patients in the tertiary stage, discharged from the hospital, coming home with something, a disease, a condition, an event that's happened. Okay, so home health can encompass lots of different kinds of visits. All three: primary visits, secondary visits, tertiary visits. Okay. Case management. What's a case manager? A case manager is the person who coordinates and manages the care of patients across the continuum. We see a lot of case managers in the hospital that are discharge planners that help transition the patient from the hospital to home, or the patient from a hospital to a nursing home or assisted living facility. But there's also lots of case managers in public health in the community, right? Because in the community, we're typically managing patients that have complex needs, multiple complex needs. And that case manager needs to be able to understand how to do referrals, education, communicating with multiple physicians, identifying services needed. So that case manager is your coordinator of care. Almost every aspect of nursing has case managers. You may have a case manager that follows triple heart patients, a case manager that follows stroke patients in the community, a case manager that follows diabetic patients in the community. Okay. As a public and community health nurse, you need to have an abundance, or know what the abundance of resources are in your community. Okay, if you're caring for a patient with multiple complex needs, or maybe a simple need, you need to know what's available, what nonprofit organizations, volunteer organizations, Meals on Wheels, Red Cross, pregnancy testing centers, food banks, transportation services, domestic abuse shelters. So you need to be familiar with what your community resources are. In your Med-Surg textbook from this week, you were asked to read pages 83 through 99, which is post-op care. What's always the first and most important with post-op care? Your ABCs: safety, pain management, potential complications. How do you do a post-op assessment? What are potential complications? What do we do in our assessment phase? Think of your nursing process here. What kinds of things are we looking for in the assessment? What are we looking for after we do our assessment? And then we start our planning and interventions if we suspect complications, or we're trying to prevent complications. Okay. Next section is specifically on cirrhosis. Okay, here's where you find it in your book. What are some common causes? What's the anatomy and physiology of cirrhosis? What do you do when you're teaching families of, and I know you've covered these next several diseases in Med-Surg, so we're just going to quickly review them. What are some interventions for cirrhosis patients when you're teaching? And COPD. Next topic. What is it? What are some interventions that we use when working with families in the community setting. What about diabetes? This is both type 1 and type 2 diabetes. What's the difference between the two of them? Okay, what are the interventions for type 2? This section up top here is all about, this first section is about type 2. Okay, symptoms, what are the interventions for type 2? Actually, this is about both, this is a summary about both of them. Okay, talks about early diabetes and pre-diabetes are reversible with weight loss, dietary modification, exercise, stress reduction. How do we monitor hypoglycemia? How do we monitor hyperglycemia? What's DKA? Do they know how to use their equipment? What are some treatments? And then this next section is your peripheral arterial disease. Okay, which I know you've gone over in Med-Surg. So have a look at that section. Same with chronic venous CVI, chronic venous insufficiency. Okay, you're going to get asked about each of these on the exam. So please have an understanding of them. Okay, hypertension. You can read through these. Okay. So a lot of week 8 is a lot of week 8 is Med-Surg focused. Okay. So that's what needs to be covered in week 8. Okay. So I know short lecture, but I wanted to cover both week 7 and week 8. Please use your reading to support your notes. Don't just study your notes. If you need more information or need a better understanding of each of these topics, concepts, please go back to your reading and read more about that. Okay. So I'm going to stop there. And then I'll send you this recording. I'll send it along with the week 7 and week 8 notes. And then later on, I will get us prepared for week 9. So week 7, 8, and 9. Okay. All right. Thanks. Bye.